As mentioned, I think the topic that I would really like to talk to you about today is about investing in a broader Africa. So we're talking about technology, we're talking about services, we're talking about medical devices, we're talking about the entire ecosystem within which we're operating. All right, some of the challenges that we've seen having invested in the continent for almost 20 years in the space of healthcare, and some thoughts on is that we have a young and rapidly urbanizing population. The urbanization rate that Africa is seeing today is the fastest in the world. Our cities are adding 13.8 million people a year and will continue to do so until 2025. And by 2040, 1 of 5 young people in the world are going to be African. And we will have the largest working age population on the continent. And these are people who will need healthcare. And our systems today are insufficiently set up to account for this. So we have 11% of the population of the world in Africa. Yet we bear 24% of the disease burden, and we only have 3% of the health workforce. These numbers don't stack up well in our favor. And also some ideas to think about in terms of how we can overcome some of the challenges to try and unlock the potential of developing the healthcare space on the continent in a way that meets our future requirements. 65% of all healthcare expenditure on the continent is out of pocket to the private sector, and the quality, frankly, is not that great. So getting this quality up is very important. One of the businesses we invested in is a syringe manufacturer in East Africa. So we backed a Kenyan producer of these syringes. Now, up until this Kenyan producer took 2 years to get the quality standards, the WHO certification standards, and therefore they're now qualified to bid for these tenders. And what did? They reduced the price by 1/3. And they were able to do it because they did not have the same cost structure as the European producers of syringes. So you can build the best diagnostics facility in the world, the best technology in that facility, but if you have not looked at the flow of how patients move through your facility, you are missing a chance to actually be faster, be cheaper, be more effective. Good health leads to strong economies. Between 2002 and 2012, the African GDP quadrupled. Until 2025, we're actually expecting it to increase by 2.5 times. That is not going to happen if we don't have a healthy population.